Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Oluyemisi Famuyiwa, fertility specialist. Today's Kevin MD article is Uterine Aging and IVF, Why the Soil Matters as Much as the Seed. Yemi, welcome back to the show.
Thank you. Thank you. Thank you for having me.
All right, what's this latest article about?
So today I wanted to focus on one thing we don't always talk about, which is the uterine aging. I mean, the first thing we talk about when it comes to fertility is the eggs getting old. Everybody's thought about that. Your eggs tick-tocking away. But nobody understands that the uterus also ages as well. And that's newer topic that we're discussing.
All right, why is the uterus ignored?
Isn't that something? I think most of the time in the past, we've always focused on it must be the egg, there's something wrong with the egg. But there have been studies where they looked at women who used donor eggs to conceive, and conceivably those eggs are from younger women. But they found out if they use younger eggs and they implanted it, if it wasn't an older patient versus a younger person, there was a difference in pregnancy rate. So the age of the uterus matters just as much as the age of the egg. And that's now, we're just now working on that. All that science is just now coming out.
So, give us a basic physiology review in terms of the role of the uterine wall. Just tell us what it is in the normal reproductive cycle.
Yes. So what we're finding out is the uterus, the lining of the uterus is thinner in older women. So the chances of them successfully implanting is lower. And also the ability of the lining to convert from, say, a regular spindle, early follicular phase lining cell to a decidualized, we call it decidual, where the cells become puffy and fat, create a rich carpet or lining where the embryos can implant in. That ability to convert changes. And you see structural issues in the blood vessels feeding the lining, as well as the type of cells that you see. So in a sense, what is happening is it's creating a very unfavorable environment for implantation to occur. Now we're knowing that there are two causes, there are two reasons why this happens.
Mm-hmm.
One is the epigenetics that is being changed. They call it epigenetic drift that gets worse with age. And the other is senescent cells. And those are like, let me talk about the epigenetic first, and then we'll
Sure.
talk about the senescence. So epigenetic, if you will, let's say, think of it as a software problem and a hardware problem. Your hardware is your uterus. The DNA in the uterus doesn't change. It's the same from woman to woman, young or old. That's the DNA. What's different is the software that runs the computer that runs the uterus. The software gets corrupted. So when you're replicating the software over and over, because the lining changes and sheds, each renewal of that lining, each change corrupts that software.
Mm-hmm.
That corruption is called epigenetic drift. So it's not working as well. The other issue is with age and with stress and environment, you build up what is called senescent cells, right? Think of it like zombie cells. They're cells that are supposed, especially in the stroma, that are supposed to be converted to the decidualized cells ready for implantation. But what happens is these cells, they lose the ability to decidualize,
Mm-hmm.
but they don't go quietly and die off into the night. They just stick around. They're not dying away, they're not converting, but they start to produce toxic cloud. They start to produce this inflammatory environment that is also killing off adjacent cells, if you will,
Mm-hmm.
right? So an analogy of it is think of the uterus like you've got a quiet nursery, you're singing nursery rhymes, maybe a quiet light in the background, ready for a baby. And then you got the senescent cells that are like, they come in with a construction jackhammer and they just jiggy up the uterus and
Mm.
loud music blaring, baby's not going to hang out in there. They turn the environment from being receptive to being inflammatory and unaccommodating.
Tell us about some of the factors that makes the uterus and the uterus lining less accommodating, using your analogy.
Yeah. So using that analogy, what happens is the first thing is your so-called epigenetic drift. They've done research where they found out, if you will, we talked about the epigenome being your software that runs the computer. If the epigenome presents the receptor in a favorable way, right, that genetic material is read, right? It's like you have a cookbook, right? Your epigenes says, okay, read chapter A, read line 1, 2, 3. So, but all the chapters are there. The epigenes decides which chapter is read. And as you get older, these changes, methylation, histone formation, they can decide, well, you're not reading this chapter today. So you may have everything ready, but you can't access the information. So think of it like, for instance, progesterone, right? Progesterone converts the spindle cells to decidual cells. That's its job. It goes into the DNA and says, time to change, guys. But the epigenome changes so that the progesterone may be there, but the DNA can no longer respond, right? So a lot of women think, I'll just take more progesterone. I just need to up my progesterone. Please check my progesterone level. Yeah, the progesterone is just fine. But the uterus is now deaf to the progesterone. It's not going to respond with that. Now, if you also have the senescent cells that we talked about, inflammatory cells that create this abnormal environment, you have to find a way to dumb it down, to take down this so-called senescent cells. You don't want to get rid of all of them because you need some level of inflammation for implantation to occur. But you need to tone down this abnormal cells, this zombie cells, such that the uterus can now hear the progesterone coming by, right? If you will. So there's a lot of fascinating research going on with that.
So how can we measure how healthy the uterine wall is? I think you mentioned
Ah,
in your article
yes,
that ultrasounds measure endometrial
correct,
thickness, but
correct.
that's not really an
Yeah,
accurate measure of how receptive the
yeah.
uterus is.
Right. So that is an area of fascinating ongoing research. We don't have it yet. There were several things that came out, in the past. They talked about endometrial receptivity assay, which now it's not as accurate as we once thought, right? So the new research, and this is pure research, is can we measure the age of the uterus in an epigenetic fashion? Most people know about the Horvath aging, you go do your DNA methylation, and they can tell you what is your biological age. That doesn't work for the uterus. Why? The uterus regenerates.
Mhm.
So what do you measure? Think about if you were to measure, let's say you have a tree and it grows new leaves every time the weather changes. You can't just go sample a brand new leaf and say, oh, this tree is only 2 weeks old, right? No, the lining changes so frequently, so you can't use that old clock that we've used everywhere else. They are now coming up with newer clocks that takes account for the cell's regular transformation, one of which is called the Zane clock. And so far, that's been done in animal studies, not in human yet. But the long thing of it is, it's very difficult to measure in humans. But if we could measure the age of the uterus, if we could now target some of the senescent cells with either agents that can get rid of them or make them inactive, I think that would be the wave of future research. That's going to be possible. In which case, the uterus will never age again
Mhm.
because we can write patches to fix the software of the epigenome.
So it sounds like we are making the reasons why eggs fail to implant more objective, right? More data.
Exactly.
Whereas before, we just didn't know why some eggs implanted or
Exactly.
not. Now we
Yeah.
have more data to make it more objective.
Exactly. Yes. So, patients come to see me and they say, well, I'm 52-year-old and I don't understand why I'm not getting pregnant. Well, you may use a 24, 25-year-old donor egg, but your uterus is 52, right? So that may account for the severe discrepancy between the pregnancy rate in a younger uterus versus an older uterus. And until we can reverse the aging on the uterus, that stock difference is going to remain.
So, what are some things women can do to maintain the soil analogy, maintaining the
Right.
health and making the uterus as receptive as possible? Is there
A
anything
lot
women
of
can do?
So a lot of what we have right now is, there are some supplements that they call them senolytics, senostatics, like quercetin, if you will, that you can use. But ultimately, what I usually guide my patients to is try to decrease or leave a anti-inflammatory life so
Mhm.
that we don't create more of this senescent cell. Try to reduce your oxidative stress with your diet, with your environment. That's the little we can do right now until we know more about the science.
So, tell us about some of the things moving forward. You mentioned that this is an area of emerging research. What do we have to look forward to?
I think going forward, I would love to see the age where we can actually at each level maybe say, wow, let's clock the uterus scientifically. And then maybe, okay, now we know the age of the uterus. Maybe there's a specific senolytic or senostatic that can be applied and then applied to the uterus and then remeasure it and see have we successfully reversed it in this uterus? And would that translate into improved success rate? We don't know yet.
So, tell us what you're doing now in the office when you talk to families and in terms of maintaining how receptive the uterus is. How do you counsel patients?
So for now, what I counsel them is, like I said, lifestyle, but
Mhm.
also we're looking for things that are obvious. I mean, this doesn't go into some of the things I've said. We have to pick the low-hanging fruits,
Yeah.
like, do you have a fibroid that can be removed?
Hmm.
Do you have endometriosis? Is it affecting your uterus? Do we need to suppress that so that the inflammation from that goes down before we talk about implantation? Do you have a defect in your uterus, such as an isthmuscell from a C-section, because that can store fluid that can also raise the inflammation in the uterus. So little things like that we can look for and try to fix.
We're talking to Yemi Famuyiwa, fertility specialist. Today's KevinMD article is Uterine Aging and IVF, Why the Soil Matters as Much as the Seed. Yemi, let's end with some take-home messages that you want to leave with the KevinMD audience.
Thank you. Take home message. The uterus factor is real. So when you go to see your doctor, you can ask questions and have them evaluate your uterus, especially when you're not getting pregnant. You want to look at not just the eggs, but also the uterus.
Yemi, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you so much for having me.